Hello, everyone. My name is Ben Rollans, and together with Emily Pynoo and Dr. Melissa Tremblay, we have created our poster, F You, I Don't Want to Effing Talk to You, Strategies for Mental Health Professionals to Build Relationships with Structurally Marginalized Youth. Emily and I were lucky enough to come on as Melissa's research assistants for a community-based participatory research project funded by Alberta Education. The goal of this project was to explore the social-emotional strengths of students pursuing alternative education pathways. To get students' perspectives on this topic, we conducted 6 focus groups with students pursuing alternative education through Boyle Street Education Centre, or BSEC. BSEC is a charter school in Edmonton, Alberta, that serves students who have faced barriers in mainstream schools. BSEC's mandate is to prioritize the well-being and learning of students in order to foster their growth. To do so, they offer wraparound supports, including access to mental health services. In total, 14 unique participants, ranging from 15 to 20 years of age, attended the focus groups. 8 of these participants identified as men, 5 as women, and 1 as gender diverse. We asked the students about different assessment strategies that mental health professionals typically use to assess social-emotional strengths, such as structured questionnaires and clinical interviews. Students shared how they often felt that questionnaires are too personal and in-depth to fill out early in the therapeutic relationship. Following this discussion, students also shared experiences with therapists where they felt that the therapist was moving too quickly or trying to get information that the students were not yet ready to share. This led to a discussion of effective strategies that mental health professionals can use to engage with structurally marginalized youth. Though this was not the focus of our initial research plan, in the spirit of participatory research, we followed the students' lead in this discussion and guided further exploration of the topic. When we conducted our data analysis, we recognized this as another important area of inquiry. So we conducted a separate thematic analysis to better understand youth's recommendations for mental health professionals. Through this thematic analysis, we identified 3 key themes that summarize students' recommendations to help mental health professionals build relationships with structurally marginalized youth. The first theme we identified is get to know each other. The students emphasized the importance of reciprocal relationship building, in which the mental health professional takes time to talk about themselves, but also takes time to get to know the youth as a person before diving into deeper, more personal topics, such as questions about drug use, sexual activity, and trauma. One student spoke about the importance of mental health professionals talking about their own lives, saying, "How am I supposed to be comfortable around someone I don't even know anything about?" Another student appreciated the mental health professionals getting to know her as a whole person rather than just focusing on her problem, saying, "If you go to a counselor, they're just going to say, 'What's your problem?' What's bothering you?' They're not going to get to know you." The second theme is respect boundaries. Students shared that there are certain topics that they did not feel comfortable talking about with mental health professionals, especially early on in the therapeutic relationship. As mentioned previously, this also applies to overly personal questionnaires and clinical interviews. We identified connections between this theme and the first theme, getting to know each other, and that students described that mental health professionals who did not know them well were not aware of their boundaries, and also that their boundaries became more permissive as they build relationships with their mental health professionals. One participant succinctly summarized this theme when she said, "Even prying is a boundary. I don't like that, so don't try." The final theme is be patient. Students emphasized that it could take a long time for them to build trust and rapport with mental health professionals. Importantly, they noted that professionals who were patient and who stuck with them, even though the students were not initially comfortable enough to discuss their personal lives, ended up building effective relationships that were valuable and useful for the students. The students made clear connections between this theme and the first 2 themes, getting to know each other and respecting boundaries, and that the therapists who took the time to build a reciprocal relationship, who respected their boundaries, and who were patient were the most effective in working with them. One student spoke about the frustration of feeling rushed by her therapist, saying, "If they're asking a question and you don't answer it, then they're like, 'Well, I can't help you if you won't talk to me.' It's understandable because it's kind of true, but it's like, just give me some time." Damn. This theme and the extent of patience that is sometimes required is captured by a student who said, "I had a therapist before and I didn't like to tell her stuff, and it took 2 years for me to finally be open to tell her." So the 3 key recommendations these students had for mental health professionals working with structurally marginalized youth were build reciprocal relationships, respect boundaries, and be patient. If mental health professionals follow these recommendations, we think that more youth will want to effing talk to them. Through this project, we learned about the value of conducting participatory research with youth. If we had gone with a more quantitative or strictly research-led approach, we would not have gotten such rich data, both within the scope of our initial project and outside of it. Being flexible with our research approach and emphasizing the importance of participatory research allowed us to give a platform to youth's voices and explore both clinical and research implications of our findings. Thank you so much for taking the time to listen to our presentation.